Now, if we could only use that mind power to transform the hearts and minds of the congressmen and women down here to adopt single payer, so that every man, woman, and child, regardless of their race, their ethnicity, their economic background, their prior health experiences, can receive coverage. Does that sound right? It's a human right, y'all. It's very, very simple. It's a human right. America happens to be the only industrialized country that has not adopted a single-payer type plan for its citizens. Now, what is up with that? Well, simply put, as the woman Sonia Umansor so eloquently stated, this is a capitalist economy, and they put profit before people. In fact, the insurance companies have a little habit of doing something called dropping the poor. Have you heard of this? Dropping the sick. You've heard of this? Okay. Well, there was a movie you may have seen called Sicko, and they show a very explicit example of this from some cameras, okay, where they capture video of a woman being dropped out of the cab into the street, who was disoriented because she was on all types of medications, had no idea where she was, didn't know where she'd been, was totally disoriented and lost. Well, this happens more often than you might think. And these are one of the things that we want to put a stop to as it relates to the health care system, or what some are calling the sick care system here in America. Experience of what she's been facing. So show her some love. She's made the sacrifices, gone to jail on behalf of this issue, y'all. There's real people out here making real sacrifices as far as this is concerned. So we applaud you, we salute you, thank you.
Thank you, Makua. It is a pleasure to be here, and I represent 16,000+ physicians from Physicians for a National Health Program who have been working for 22 years with one mission, one goal, and that is to educate and to do research on single-payer health care reform, because we know that it is the only way we're going to accomplish universal health care. The President said it himself on Tuesday when asked how many people are going to be covered with the plan that Congress is proposing. And he paused, and then he said, well, not everybody. The only way to cover everybody is to pass single payer. So why aren't we doing it? Why aren't we doing it? I'm a psychiatrist in Southern Maryland. We have plenty of people in Southern Maryland who are uninsured, and we have plenty more people who are underinsured. I have people coming into my office every day who already have a mental illness. That's bad enough. That's struggle enough. But on top of that, they're struggling to afford to get care for their mental illness. They want care. They want help. And they can't get it. I have patients who take half as much medicine as they're supposed to because they can't afford the copay for their medicine. And so I have to schmooze drug reps so that I can get free samples to give to my patients. I have a patient who told me her brother, as he was falling 3 floors off of a roof, uninsured roofer, prayed to God that he would die because he didn't want to live and leave his family bankrupt with the medical bills that would take place if he was hurt. So I hear these stories. I'm a clinical psychiatrist. I see patients 4 days a week in my practice. And on the 5th day of the week, on Fridays, I spend every Friday on Capitol Hill with Dr. Margaret Flowers, who is the PNHP Congressional Fellow. Dr. Flowers is a pediatrician who quit working as a pediatrician and has devoted herself full-time to move to the movement of single-payer health care. So I also am a little bit of a jokester. So I've come up with a new clinical diagnosis. You've all heard of PTSD? Okay. Well, I've come up with one that's called PIISD, which sort of sounds like pissed. And it stands for Private Insurance Induced Stress Disorder. And I would suggest that every person here is suffering from a bad case of pissed. I know I am. I know I am, and I know that at least a third of the Americans in this country who are uninsured and underinsured, if they have ever tried to use their insurance, if they have it, get pissed. And the diagnosis is easy. Anyone who has become anxious, had trouble sleeping at night, become depressed, anyone who has maybe turned to drugs and alcohol as self-medication, anyone who worries themselves sick because someone they love or they themselves are uninsured is suffering from pissed. And I'm happy to tell you that there is a cure for pissed. There is a cure for private insurance-induced stress disorder. And every one of you are actually participating in it right now. It's called activism. It's called stand up, take a stand, speak up, and tell the president and tell Congress to take the money out of their ears and listen to their constituents. Because we're their constituents, not the lobbyists who keep stuffing money in their ears so that they'll only listen to the money and not to the people. So I encourage every one of you here, speak up, educate yourself. You can go to www.healthcare-now.org or www.pnhp.org. Both good websites. Educate yourself, educate your family, educate your friends. Come out to the rally on Thursday. Keep speaking. That's the cure. And the ultimate cure is passing H.R. 676, Medicare, improved Medicare for all. Thank you very much.